Today we're going to talk about this year's health benefits open enrollment for your employer. There have been many recent changes because of healthcare reform. So before we get started, we're going to discuss a few of these changes and how they affect you as employees of a company offering insurance. One of the big changes made in 2016 is in how the insurance carriers view groups of different sizes. Now groups with a total of 100 or less full-time and full-time equivalent employees are considered small employers. Due to this shift to small group, you will see some changes in the plans available to you, as well as how they are rated. In the small group market, all small group health plans have been categorized into one of 4 different metallic levels. As a result, the plan benefits are not as flexible or as customizable in comparison to what is available in the large group market. Platinum plans offer the richest and most complete level of coverage and typically have the most expensive monthly premium costs. Gold and silver plans offer a balance between the price and benefits, which usually results in the greatest value. Bronze are the least rich and often have a high deductible, making these plans the least expensive. All plans, regardless of their tier, must now offer 10 essential health benefits in order to be in compliance with the ACA. Essential health benefits are just one of many new rules governing health plans. All plans must offer age-appropriate preventive care at no cost to the consumer. This includes well baby care, well woman care, and physical exams. There is no longer an annual dollar limit on coverage of essential health benefits. Employees are able to keep their dependent children on their parents' plan until they turn age 26. These children do not need to be listed as dependents on their parents' income taxes. They no longer need to be full-time students. They can be married, not living at home, and still remain on their parents' plan. Under the ACA, there are now 19 standardized rating regions in California, and all carriers must set their rating boundaries based on these regions. Prior to the ACA, there were only 9 rating regions. Under the ACA, all small group rates are now compressed into a 1-to-3 ratio based on age. This is so that the oldest adult is no more expensive than 3 times the rate of the youngest. This was dropped down from a 1-to-7 ratio. All rates in the small group market guarantee issue and are non-negotiable. Now that we have covered the changes due to healthcare reform, we will discuss a few terms that will help you understand the benefits that you are being offered this year. I'm going to briefly explain the following terms: copay, deductible, coinsurance, out-of-pocket maximum, HMO, primary care provider, PPO, and in-network versus out-of-network. So let's get started. A copayment or copay is a set dollar amount that you will pay for a specific type of service, office visit, or prescription refill. Usually this amount is what you will pay at the time of your services. For instance, if your copay to see a doctor is $25, you pay that amount each time you see him or her. The insurance takes care of the rest. Your deductible is the amount you will be responsible for before some insurance benefits kick in. Usually, a deductible will apply for services with greater expenses, such as inpatient hospitalization. For example, if your deductible is $500, your insurance won't pay for anything until your costs are more than $500. Coinsurance means that you are splitting the bill with the insurance company. So, on a plan that offers 80% coinsurance, you would be responsible to pay 20%, while the insurance carrier would pay 80%. Coinsurance is paid in addition to whatever deductible you may owe. For example, if your plan allows $100 for a doctor visit and you've already met your deductible, your coinsurance payment of 20% would be $20. The insurance company would pay the 80%. This is the overall limit to your cost in a calendar year before your insurance plan begins to pay 100% of the allowed amount. Due to healthcare reform, most expenses including copays, deductibles, and coinsurance will accumulate towards the out-of-pocket maximum. This total does not include your premium or the healthcare services your plan does not cover. This amount will typically reset on January 1st each year. A primary care provider is a specific doctor at the medical group you have chosen. If you selected HMO, you will need to select a primary care provider from the carrier's website or doctor list that is associated with the medical group you wish to receive services from. The website has a PCP number or code that you will use to indicate your choice of that doctor on your enrollment application. You are able to change your PCP doctor as often as once per month if you choose. A health maintenance organization is a type of insurance plan in which the insurance carrier will pay an independent medical group a set amount per month for services. This is a benefit plan that offers access to both in-network and out-of-network providers. The benefit plan design will always offer a richer benefit for in-network access to providers, but still allows some reduced level of coverage for choosing an out-of-network doctor. On a PPO plan, you do not need to select a doctor at the time of your application. In-network doctors are bound by their carrier contracts to accept a lesser amount for services. This translates into lower out-of-pocket costs for you. Out-of-network providers do not have a contract with the carrier, so they can charge their full retail amount for services. The carrier will only pay based on the percentage that they would pay if the provider had been contracted, but the provider can send you a bill for the remaining costs. This is known as balanced billing. In-network providers are not allowed to balance bill. Now that we've discussed a few of the common health benefit terms, we need to share a bit more information with you regarding the recent healthcare reform changes. The following topics apply to all small group plans. Metallic plan levels. All new small group health plans sold after January 1st, 2014 will be categorized into one of 4 different metallic levels: platinum, gold, silver, and bronze. No-cost preventive care. All plans now offer age-appropriate, no-cost preventive care. This includes well baby care, well woman care, and physical exams. Unlimited benefits. There is no upper level cap to the amount of benefits you can receive under your plan. Dependents to age 26. You are able to keep your dependent children on your plan until they turn age 26. They no longer need to be a full-time student, and they can even be married and still remain on your plan. However, the coverage will not extend to their spouse or any grandchildren. Before we move on to the enrollment form, we need to explain exchanges. The government has established health benefit exchanges for some individuals who need financial assistance in paying for their health insurance. In order for an individual or family to be eligible to enroll in the exchange, an individual must be either a citizen of the United States or a non-citizen who is lawfully present in the United States. To be eligible for a government subsidy in the exchange, they must earn between 138 and 400% of the federal poverty level, without an offering of coverage from their employer. This means that if the employer is offering a benefit plan at this year's open enrollment, then the individual is not eligible to receive a subsidy. If you find yourself in this position and have questions, you should contact your HR manager or benefits broker for advice. Let's take a look at your enrollment form. Thank you for taking the time to complete your enrollment application. Now there are just a couple more things we need to share with you. Waivers. If you have waived coverage for yourself or your dependents, be sure to include a copy of your current medical ID card. Copies are required for anyone that has waived in order to confirm that they are valid waivers based on the underwriting criteria. This helps to protect your rights. Should you or your dependents lose that other coverage, you would be able to add yourself and/or your dependents without having to wait until open enrollment next year. RX. If you are currently taking any prescription medications, It's a good idea to get a refill just prior to the end of the month, under your old coverage. There is often a transition period when your coverage is moving from one carrier to another, and getting early refills will prevent you from running out of your medication during the transition from your old plan to your new one. Pending procedures. Please let your HR manager know immediately if you have a pre-scheduled surgery or major appointment that you cannot reschedule, if it will occur anytime within the first 2 weeks of your new plan. Your broker may need to make special arrangements with your new carrier in order to accommodate your needs. Signatures. Please carefully review all of your enrollment forms to ensure that you have completed everything, and make sure to sign and date them. Be especially careful in regards to the enrollment and waiver section of your applications. If you have any questions, your HR manager can contact your broker to assist you.